Mr. Speaker, thank you for that recognition. Thank you for this time. Mr. Speaker, over the past several weeks, I've been talking to my constituents. I've been talking to former patients about the importance of Medicare and how Medicare has impacted their lives, how they've relied on it. You know, as a doctor, I've taken care of thousands of patients who have worked their whole life paying into a system so that they could rest easy at a time when they needed their health care. They wouldn't have to worry about it. You know, this is a value and a program that has served millions of Americans for decades. They've come to rely on Medicare. It is a program that works. It is a program that we've come to rely on as doctors. You know, let me even make it a little bit more personal than that. Let me tell you the story about my parents who came here as immigrants over 50 years ago. My mom was a public school teacher. Dad was an engineer and a small business owner. They got up every day. They went to work. They paid into a system over a lifetime so that when they needed their health care, they could rest easy. They knew they had a Medicare system. Let me even make it more personal. You know, over these past few years, my dad's in his late 70s. You know, he's needed knee replacements. He was able to get them. His doctor was able to order the care that was necessary to take care of him. You know, a few months ago, my mom suffered a mild stroke. My dad didn't have to hesitate about whether she could get health care or not. My dad could pick up the phone, call 911, and get her to the hospital. She was able to get the care that was necessary that millions of Americans count on. Her doctor was able to come and see her. Her doctor was able to order the post-operative care that was necessary. That is why millions of Americans rely on Medicare, so they can rest easy at a time when they need that security of health care. It is a system that works. It is a system that working men and women in America pay into over their lifetime so that when they're at their most vulnerable, they're able to get the care that they need. I've seen it time and time again as a doctor. Let me even share one more story with you. As a young intern training in internal medicine as a doctor, you know, one of my first patients was a Roman Catholic priest, Father Mike. You know, it was my first month working in the hospital and doing my rounds in the intensive care unit. Now, Father Mike was afflicted with ALS, more commonly known as Lou Gehrig's disease. Father Mike would come in and out of the hospital and would be devastatingly sick. For those of you who know about Lou Gehrig's disease, it is a progressive illness that slowly deteriorates and eats away at your body. It takes away your muscles and your ability to breathe. So over the course of 2 years, I would see Father Mike repeatedly, coming in and out of the intensive care unit. He needed that care to keep him alive. Without Medicare, he wouldn't have been able to afford the care. Now let's ask ourselves as Americans, what are our values? Our values are that we take care of our seniors, that we take care of our parents and grandparents, and we want to honor them after a lifetime of work. Those are who we are. Those are our morals as Americans. And that is why I'm on the floor of the House of Representatives today to talk about how important Medicare is. Not only for my parents, but for parents throughout this country, for grandparents throughout this country, but also for that next generation that is currently paying into the system. And I'm not alone. My fellow colleagues in medicine care about this deeply. And with that, I would like to recognize my colleague, Dr. Raul Ruiz, a fellow physician from California.
Thank you, Dr. Bera, for yielding. This Congress has a responsibility and an opportunity to work together to grow our economy and set this nation on a fiscally responsible path. However, the Ryan budget is irresponsible and places the burden of the deficit on hardworking American families and seniors. This plan ends the guarantee of Medicare. And as an ER doctor, I know that many of my senior patients are struggling financially and rely on Medicare in their moments of their lives when they need it the most. Our priority should be reducing healthcare costs in order to make Medicare stronger and more sustainable. But this budget transforms Medicare into a voucher program, shifting the costs of health care onto the shoulders of our seniors. And we must once again work together to protect and preserve Medicare, reduce our deficit, and decrease healthcare costs. I urge my colleagues to come together across party lines and put American families and our seniors first. I yield back my time to Dr. Bera.
Thank you, Dr. Ruiz. I urge Americans to share their stories. I urge them to share the importance of Medicare, how they rely on it. Share the stories about your parents and grandparents. I urge the members of this body to share their stories. We all have parents and grandparents. We all care about this program, and we all have stories to tell. You know, just today in my office, I had a colorectal cancer survivor come visit. You know, she talked about how her cancer was diagnosed early because she was able to go get a colonoscopy, that she was able to get the preventive care services that were necessary. She would not have been able to do that had she not had access to Medicare, had she not had access to basic cancer prevention. That is what's at stake here, is making sure that our seniors, that our parents and grandparents have access to that care when they need it the most. That's why I'm on the floor here today, because we have to protect Medicare, a program that has worked for decades. It is a program that we rely on, and I want to hear your stories about how we protect Medicare and make sure it's there for the generations. It is a program that's worked time and time again. You know, let me even share another story of patients that I've taken care of. You know, I've taken care of hundreds of men and women who do physical labor, construction workers, you know, folks that get up every morning and go to work. They don't make a lot of money, but they pay into a system. You know, I'd encourage every American to pull out their paycheck and take a look at it, and you'll see right on there that you're paying into the Medicare system. Even those that are 25 or 30 years old, we're paying into a system. Why do we do that? Well, we pay into the system so that when we need our health care, we're able to get it. That's what we do as Americans. We know we're in this together, that we care for one another. That is the beauty of why Medicare works so well. That as I'm working today, am paying to make sure my parents and grandparents have the health care that they need, so that when I need that health care in retirement, when I'm a senior, I can get it, and I can rest easy and not have to worry about that. That's why we're encouraging you to share your stories, and we want to hear your stories about how Medicare has impacted your life and why it is so vital that this body protects Medicare and strengthens Medicare. Share your stories with us on Facebook or Twitter. I'd like to now yield my time time to my colleague, the distinguished lady from Florida.
Thank you, Congressman. You know, listening to your talk, I've been inspired to share my story, my personal story of my mom. I told this story a little bit a few minutes ago, but it's worth repeating because about 20 years ago, my mom had just reached Medicare age. She was a widow on a fixed income, and she was diagnosed with breast cancer. I had a young son that time. He's grown now. He was 13 years old. And our family was blessed because my mother had Medicare, and she was able to get the health care, the good health care that she needed, and she's still with me today. I didn't have to choose between helping my mother with her health care treatment or saving money to send my son to college. And that's the kind of choice Americans are going to have under this Republican budget. Because the Republican budget doesn't make seniors healthier. It just shifts the burden. And my district is filled with people from all walks of life, all different professions, whether they were teachers or nurses or accountants, and they worked hard their whole life, and they saved up in their Medicare account, and so they can live with the comfort now of knowing that if they get sick or they get injured, their health care that they earn will be there for them, that they will not be a burden on their children, that they will not take the savings that their children have for their grandkids' college education to have to be used for their health care. And so, but it's not enough. It's not enough, Congressman Bera, for us just to say the Republican budget is bad. Because the fact of the matter is, the American people and my constituents, they want answers. They want us to be problem solvers, not problem creators. They want us to get something done. And the Democratic budget gets something done. And just on this issue of health care for our seniors, we secure Medicare for this generation and generations to come because we look and we focus right on what the problem is, and that has been the growing cost of health care. And just in the Affordable Health Care Act, we tackle the problem directly. We reduce overpayments to health care, to insurance carriers. We look for efficiencies in the delivery of health care. We focus on prevention. We make health care more accessible to more people so that when they enter their Medicare ages, they're healthier. And so the Democratic budget has a solution to a challenge that all Americans recognize today. And so, Congressman Bera, I want to thank you for allowing me to spend some time to speak on behalf not only of my family, but so many of the families in my district in South Florida who depend on Medicare to live full lives. And I yield my time back, Mr.
Thank you, Congresswoman Frankel. You know, I look at this whole issue from the eyes of a doctor. That's how I have to. That's how I was trained as a doctor. One of the first rules that we take when we're sworn in as doctors, the oath and the promise that we make, is to do good, benevolence. That is core to what we do, and that is core to what this body needs to understand. This is not about Democrats versus Republicans. We need to come together to do good for our parents and grandparents, to do good for our seniors, to make sure we honor the promise that we made to them, that after a lifetime of work, that they would be able to get the care that they needed when they needed it the most, that they could rest easy and not have to worry about getting the care that they needed. Those are American values. Those aren't Democrat versus Republican. We need to start setting aside that partisanship. And as the oath I took when I became a doctor and when I was sworn in to the profession of medicine, we need to do good. We need to have the courage to put our patients and the American citizens first. That is what this is about. That is why I'm on the floor today, talking as a doctor about the patients that I've cared for. Now, I've heard from others that I represent. Tina shared a story with me. Her father died a few weeks ago after spending a month in the hospital. Medicare meant her family never had to worry about what the cost of his care was during his illness. Medicare meant that her mother doesn't have to live a life in bankruptcy now, that she could rest easy, that her husband was able to get the care that he needed. Medicare meant that they knew in her father's last days that he was getting good health care, that his doctors were able to give him the care that was necessary at the end of his life. Tina has urged me to fight every day to make sure that every family has the same peace and the same support and the same security that her family had and that she felt at a time when her father needed the care. That's what this is about. This is about doing what we do as Americans. We care for one another. We build a system where we're all in this together, where those of us who are working are paying into a system over a lifetime so that the seniors of today are able to get that care, and that we pay it forward. Those are our values. Those are American values. That's not Democrat versus Republican, and we've got to get past this. We have to, as we're on this floor, as we're making votes, we have to think about those that came before us, our parents, our grandparents, the seniors that built this country. That is who we are as Americans. And that's why we want to hear your stories about why Medicare is so important. Share those stories with us on Facebook. Share those stories with us on Twitter. Let your representatives know why it is so important that you want us to keep fighting for Medicare every day. I'd now like to actually hear a story from my colleague, the distinguished gentlewoman from the great state of Ohio.
Thank you so much, Congressman Barrett. What a great opportunity for me to tell my story when I think about Medicare and what that means to me. But more importantly, what it means to this nation, what it means to the citizens in the 3rd Congressional District that I represent, what it means to someone's mother, someone's grandmother, someone's spouse. Medicare is something that was created and seniors have paid into it, oftentimes for a lifetime. And then they get to a point in their life when they want to be able to use something that they paid into it. Medicare is something that you're going to hear from people about. I agree with my colleagues that Medicare is not, nor should it be, a Democrat or a Republican issue. It should be something when you think about being able to provide health care for the same individuals who put so much money into it that they can now be able to use it. Medicare helps save lives. Medicare is part of what I think of as part of the American dream. Medicare is something that we should be proud to be able to say that we're going to take care of our seniors. You see, a few years ago, my father was very ill, but it was because of Medicare that I was able to witness him getting quality health care. I'm fortunate. My mother is still living, and like many of my colleagues who have come here today and talked about the wonderful benefit that they had by being able to know that their parent was being taken care of and they were going to be able to have the quality health care. Isn't that something that we all want? Isn't that something we want as a Democrat? Isn't that something we want as a Republican? Let me tell you what I know the citizens of the 3rd Congressional District want. Let me tell you what I really believe the citizens of this wonderful country we live in want. I think they want to see us working together. I think they want to hear solutions. I think they want to know that they can trust us because they sent us here not to be in gridlock, not for us to be fighting, not for us to be arguing without resolve. And that's what Democrats are saying to you today. We have taken this issue that touches lives and reaches across America, and we are saying it is our responsibility as members of Congress, members of this 113th Congress, that we should make it one of our key responsibilities to stand on this floor and tell those stories, to tell those stories about Medicare, to tell those stories about the lady who lives down the street from me and how fortunate she was because Medicare saved her life. We should be able to stand on this floor and give speech after speech to say to America, you sent us here to protect those who are our most fragile citizens, those who have given so much that we stand here. So you see, my story is quite simple about Medicare. It's about exercising our right to protect those who paved the way for us. It's about me saying proudly as a Democrat, our alternatives to the budget as it relates to Medicare is the best solution. It's about saying we should not make it a voucher program. It's about saying that we should not take monies from Medicare and give to other companies that don't need it. You see, it's quite simple. It's a story about saving lives. It's a story about doing all the things that we say as public servants. It's about the oath that we took as an elected official, that we would serve our communities, that we would come here and make a difference. So, Congressman Bera, for me, it's about standing strong and saying to my colleagues on both sides of the aisle, join us and make a difference, in making a difference to help our seniors and to protect and to save Medicare. And that's my message and my story. And I yield back.
Thank you to my colleague from the great state of Ohio. That's why we're asking folks today to share their stories. We'd love to hear your story about how Medicare has affected you or a family member or a friend. Share it on Facebook or Twitter. We want to hear those stories. This body needs to hear those stories. This body needs to make sure when we're taking votes, we're voting understanding those stories. You know, as a doctor, I took an oath to do good, to do no harm. Well, if Medicare becomes a voucher program, it'll do irreparable harm to thousands of Americans, and that is not what we need. The reason why I'm on the floor today is to talk about the good that Medicare has done for millions of Americans. Americans like another one of my constituents, Pat. She shared with us a story. You know, Pat was a single mom. She worked hard her whole life and raised 2 kids on her own. Pat's now 77 years old. She has high blood pressure, diabetes, and heart disease. She had to have open heart surgery and afterwards was prescribed very expensive medications and cardiac rehabilitation. She had to get back on her feet because she wanted to be with her family. There's no way Pat could have afforded that surgery if she didn't have Medicare. There's no way Pat could have afforded the medications that she needed if she didn't have Medicare. There's no way that the doctors that cared for Pat would have been able to prescribe the therapies that she needed to keep her alive. That's what's at risk here. This is about protecting our seniors, making sure that after a lifetime of work, after a lifetime of paying into a system, that they can rest easy, that they don't have to worry about whether they can get the health care that they need when they need it the most. They can rest easy. That's why we want to hear your stories. Please share your story about how Medicare has impacted your life or your family's life on Facebook or Twitter. Now, I'd like to now yield my time to my dear friend and colleague from the great state of California, my home state. Thank you.
I want to thank my friend, Dr. Ami Bera, for allowing me to speak for a few minutes. And thank you, Mr. Speaker. You know, we are here today to dispel the oft repeated notion that Medicare is somehow the problem in the current fiscal crisis. Republicans have, in budget after budget, attempted to voucherize the program and end the Medicare guarantee as we know it. They would break the promise we made to our nation's seniors decades ago, one in which we told hardworking middle-class Americans that if they paid in through their wages and trusted in their government, that they would be taken care of. Medicare is the most efficient health plan in our country. It has a 2% overhead. Let me repeat that. It's a 2% overhead, more efficient than any private plan. The problem isn't Medicare. The problem is the rising cost of health care. And what it is that we have to get that under control. It's a cost that has gone up exponentially in our country compared to the rest of the world. Republicans want to do nothing about the real problem of rising costs. Rather than tackle the hard issue, they want to shift the costs onto seniors. People like my mom, she's 96 right now, and she depends on that important program. 6 years ago, she had to be checked up for a heart condition, and she had a aneurysm below her diaphragm and was part of the arterial system. They said that it would be difficult to be able to provide a stent because of her age, and she was 70. Well, a few years later, that aneurysm grew a little larger, and it became pretty critical that if nothing was done, that she would die. And the doctors looked at her again and noticed that at the advanced age of 90, she walked around and was acting like she was 70, and the doctors concluded that we could do this with her, and she has a 9 out of 10 chances of survival. If she did not do anything, the chances of survival would have been a lot less. And my mom thought about it. She pondered about it. She says, I'm 90. I've lived a good life. Let's take this 9 out of 10 chance. And she put her faith not only in the hands of the doctors, in the system, but also in the hands of her God. After a few hours of operation, she came out, and it was successful. But none of this could have been possible without Medicare. we would not have been able to afford it, and neither could she have afforded it. She grew up as a child of a businessman during pre-war United States. And then her adult life, as my mom, she worked as a domestic, so she had no pension plan. She had no other plans that would help her in her old age, except Medicare. So, time and time again, when Congress was looking for an easy way out in dealing with these issues, leaving folks like my mom holding the bag, this whole issue is personal. And I'm sure that this is a story that could be shared by almost every family in this country in one way or another when we think about Medicare. So, having the middle-class Americans and people like my mom holding the bag, it is absolutely unacceptable. It is wrong, and it is quite cowardly. One of the major reasons for our health care costs keep going up because we have not changed the way patients and doctors see each other. We must be innovative and creative in tackling the traditional costs of health care. As a representative representing Silicon Valley, I have helped lead the way in this by promoting innovative technologies such as telemedicine, personal health connected devices, and other tools. I will be reintroducing the Healthcare Innovation and Marketplace Technologies Act later this year to continue this effort. And let's hope that folks on the other side will understand its importance. Most importantly, however, I will continue to stand with my friends here in the chamber tonight to protect Medicare and the Medicare guarantee. We can fix our nation's fiscal house by being innovative rather than using the same old ideology. We can improve our nation's standing by being courageous and standing by our nation's seniors. I want to thank you, and I yield back.
I thank my dear friend and colleague, my Congressman Honda from California. Yeah, the reason why we're here today, the reason why we're speaking on the floor today is because of the importance of Medicare. This isn't a Democratic or Republican issue. This is an issue that affects all Americans. It's an issue that is dear to all Americans, to all American families. It isn't Democratic or Republican. That's why I'm wearing this pin that says no labels. Because we've got to move past these labels, Democrat versus Republican, and think about what our values are as Americans. The values of making sure we take care of our parents and grandparents, that we honor the foundation that they built for us, that those that came before us built, that we honor after a lifetime of work, after a lifetime paying into a system, that they can rest easy, that they know they can get the health care that they need when they need it the most. That's why we want you to share your stories with us about how Medicare has impacted you personally or your family. I think about this and the thousands of patients that I've taken care of and what Medicare has meant to them, how it's saved millions of lives, how it's kept millions of families from falling into poverty because they were able to get the health care that was necessary when they needed it the most. You know, another one of my constituents, Catherine, shared a story with us recently. Catherine had a sister who was diagnosed with lung cancer and chronic lung disease. At first, Catherine was hesitant. She was a little bit worried about using her Medicare because she didn't want to be a burden. She wanted to be independent. But she looked at it and she realized she had paid into this system her whole life and was grateful that it was there for her. She realized that she wasn't being a burden, that this is the system that she had paid into, and it was there for her. And you know what? Medicare covered her bills and kept her alive. That's why we're here on the floor today talking about Medicare. And when I talk about this, it's personal. I talk about this as a doctor. I talk about this as a son whose parents are aging. I think about the people who live in my neighborhood, like my neighbor Jerry. He's a widower. His wife passed away several years ago. Jerry's also a cancer survivor. He has to go in for routine blood transfusions and routine care. He doesn't have to worry about whether he can get that care or not because of Medicare, because he paid into this system his whole life. Now he can get the care that he needs. Millions of families across this country depend on Medicare. That's why we're here talking about protecting Medicare. And that's why we want to hear your stories about how Medicare has impacted your life. And I'd love to hear those stories and want you to share them on Facebook or Twitter. Medicare allows patients that I've seen, patients with diabetes, with high blood pressure, with high cholesterol, to get the medications that they need. Medicare allows me as a doctor to write those prescriptions and know that my patients are able to get the care that they need. Medicare is not about Democrats versus Republicans. It is about doing the honorable thing that we do as Americans, because that's who we are. Those are our values as Americans. As Americans, we want to make sure that after a lifetime of work, we're going to protect the promise that we've made to our parents and grandparents. And I know it's not Democrats versus Republicans, because you can see it at that picture of when the Tea Party first emerged in this country in 2009. They were holding up their signs saying, "Keep your hands off of our Medicare." And you know what? I'd say the same thing. As we go through these budget debates, let's keep our hands off of Medicare. Yes, we've got to address the cost of health care. But as my colleague, Congressman Honda, shared, Medicare works extremely well. It's a program that has worked for decades. It is a program that has allowed me as a doctor and has allowed countless doctors across this country to deliver the necessary care when we needed to do what we were trained to do, to be doctors. That is why I'm on the floor today, talking about how we protect that promise that we've made to our parents and grandparents, how we protect and honor the promises that we've made. Yes, we face challenges in this country. Yes, we have to address our debt and deficit, and we have to build for the future so our children grow up in the same vibrant, leading world that we grew up in, with a country that's leading the way. But we can't do that by breaking a promise that we made to our parents and grandparents. We can't do that on the backs of seniors, taking care away from them when they need it the most. This has to be bipartisan, because how we treat our elders, how we treat our parents and grandparents is a direct reflection of who we are as Americans. We need to start talking about this in a bipartisan way. We need to shelf the idea of dismantling Medicare, and we have to talk about the idea of strengthening Medicare, making it more secure so that it is there not only for today's seniors, but that it is there for the generations, that it is there for our children and grandchildren. It is a system that works extremely well. Yes, we have to talk about the cost of health care. We have to address the cost of health care. But Medicare isn't the problem. Medicare works extremely well. Ask any senior. 80% of seniors love Medicare. They don't want to see it changed. They don't want to see this body messing around with Medicare. They want us to strengthen it, and they understand that we have to deal with the cost of health care, but the system of Medicare has delivered care extremely well. That's why I'm on the floor asking you to share your Medicare story. I'm asking you to share that story on Twitter or share it through Facebook, because this body needs to hear those stories. This body needs to understand that Medicare is a vital program for millions of seniors, that our parents and grandparents depend on this program, that our doctors, our hospitals depend on Medicare. Now is not the time to be talking about dismantling Medicare. Now is the time to be talking about how we strengthen Medicare, how we make sure it's there for the generations. That's why I'm on the floor today, as a doctor, but also as a son whose parents rely on Medicare. That's why I want to hear your stories, and I want you to share your Medicare story on Facebook or Twitter. I now yield my time to my great friend and colleague from the great state of Oregon.
Thank you. You have to stay at the... You have to stay. Members are reminded to address their remarks to the chair and not to perceived viewing audience. Gentleman from Oregon. Thank you so much. I want to thank my colleague from California for being here this evening, for sharing the time, allowing me to speak with him. And I must say how excited I was that a friend who actually had a rewarding career was willing to jump into the political fray, which has been difficult at times, particularly as we've had the contentious issues surrounding health care, that you'd be willing to put your expertise, time, and energy when you had other choices with your life and career. We really appreciate it, because the experience you've had in the medical profession, the years of study, the actual experience with real-life people adds a dimension that is helpful here in ways that I don't know that you fully appreciate, but I certainly do. I also appreciate focusing on the critical nature of Medicare and where we're going in the world of healthcare reform. I just spent last week dealing with my Republican friends' approach to the budget. And it can only be described as an exercise in fantasy. They start with the notion that somehow they're going to eliminate Obamacare entirely, and they seek to transfer the burden of Medicare and Medicaid from the government onto the shoulders of some of America's most vulnerable, poor and disabled, and our senior citizens. And I really appreciate your focusing on the importance of Medicare in providing dignity and stability to millions of Americans. Now, I think there have been, between the House and the Senate, about 50 efforts or more to, quote, repeal the health care reform. And I must say that I hope that finally people get it out of their system. I was surprised that we went in this direction to turn Medicare into a voucher, a block grant for Medicaid, and put this burden on our senior citizens and some of our poor and disabled Americans. Because this was the centerpiece of their campaign for the last 6 months. This was part of what our friend Paul Ryan and Governor Romney preached from coast to coast, advertised, campaigned, and all of a sudden it was rejected by the American public overwhelmingly. The president was comfortably reelected. In fact, there were more Democratic senators added who support this effort. And in the House of Representatives, not only did we gain seats, but more than 1 million voters more voted for Democrats than Republicans. So you would think that this canard would be put to rest. But it is important for people to know that it is still a viable option as far as our Republican friends are concerned. And it's unfortunate
because we are making some progress in reforming the healthcare system. Not by turning our back on Medicare, not by transferring the risk and responsibility to seniors and the most vulnerable, but by making it more efficient. By taking some of the experiments that we've done in my home state of Oregon, and as you well know, there are some healthcare systems in California that have already found ways to reward value over volume, to be able to extend care and do so more efficiently and squeeze the approximately 1/3 to 40% or more of our healthcare spending that is wasted. We can do a better job. We start, I think, by protecting Medicare. We start by recognizing that a voucher or premium support or whatever they call it that caps the investment does nothing to reform healthcare, but instead it puts seniors and our most vulnerable citizens out navigating the healthcare maze with fewer resources and more responsibility, and actually making it harder, because that's why we have Medicare in the first place. The private market did a terrible job meeting the needs of America's oldest and least healthy population. I am hopeful that we're going to be able to continue this effort that you're spearheading here tonight for people to understand the opportunities to continue reform, to note that we are actually seeing a gradual stabilization of healthcare spending right now, and that there are things in the hopper that we can do going forward without taking advantage of people who deserve the security of a solid, reformed healthcare system, not one that the federal government vouchers and turns their back. And I would yield back to the gentleman if there are comments. I look forward to hearing what you have to say, and perhaps there may be a little more interaction if it's useful.
Well, I appreciate my friend and colleague from the great state of Oregon. You know, it is, we've heard wonderful stories from all across this country tonight, as my colleagues have shared their experience with Medicare, personal stories about what Medicare has meant to their parents. We want to hear your stories as well. Your representatives on both sides of the aisles need to hear your stories of what Medicare means to you personally and to your families. Because Medicare is a promise that we've made to our parents and grandparents, to millions of seniors across this country. It is a promise that after a lifetime of work, after a lifetime paying into a system, you can rest easy. You don't have to worry about whether you'll be able to get the health care that you need at a time when you need it the most. This can't be a partisan issue. It can't be Democrats versus Republicans, because we're all sons and daughters. We all think about, our seniors. Those are our values as Americans. It isn't who we are as a nation. We respect our elders. That's how we were raised. As a doctor, we rely on the importance of Medicare. We rely on the ability that at a time when our patients are at their most vulnerable, when they need health care, that I can write that prescription, that I can do the treatment or order that surgery when it's needed. That is the promise that we've made, and that's why we're here fighting every day. And I urge this body, and I urge my colleagues, as we are looking to address the challenges of this nation, we acknowledge and understand that Medicare is not one of those challenges. Medicare is one of the success stories of America. Medicare is a success story that has kept millions of Americans healthy and alive and given them the care that they need. Yes, we face challenges. Yes, we have to address the cost of health care. But Medicare is a success story, and it is something that we should be celebrating every day. And that isn't Democrat versus Republican. That is a success story of this body. And let's celebrate that. And with that, I'll yield back time to my colleague from Oregon.
Thank you, Dr. Barra. I appreciate your focus on this and pointing out that this is something that shouldn't be a partisan issue, doesn't have to be a partisan issue, and it is in fact a success story that has made a huge difference in the lives of seniors from coast to coast. It's helped in many cases stabilize what's happened in terms of local healthcare economics. The pattern that we have seen in escalating healthcare costs for the last 40 years, yes, there are concerns about healthcare as it relates to Medicare, but if you compare the rate of increase of private health insurance versus the rate of increase in Medicare, Medicare spending has not gone up as rapidly as what's happened with the private insurance sector. No senior citizen under Medicare needs to go bankrupt because of medical costs. The security that you mentioned. I find it embarrassing and shameful that the United States is the only major country in the world where there are still people going bankrupt for healthcare costs. Half of all bankruptcies are a result of healthcare emergencies. It doesn't have to be this way, and it is not that way for American seniors. But if we're going to change our healthcare commitment to our senior citizens, taking away the guarantee of Medicare, flinging people into an uncertain private market that failed them in the past, which is why we had Medicare in the first place, that guarantee is not certain to be there. No one thinks that we shouldn't have a healthcare system with a Medicare that is flexible going forward. We're open to reforms, absolutely. We want to reward value instead of volume. We want to be able to deal with the pattern of unnecessary medical readmissions for Medicare patients after they've been in the hospital. It's too high still. But we are working on mechanisms in Medicare and with the hospitals to be able to reward keeping them out of the hospital with preventable conditions that require readmission. We're in the process of looking at Medicare Advantage, which is growing dramatically. I come from the district that has probably the highest penetration of Medicare Advantage in the entire country. And it serves, in many cases, my constituencies pretty well. But there are wide variations across the country in Medicare Advantage. Not all Medicare Advantage programs are created equal. And again, part of what we've done with the Affordable Care Act is not to turn our back on potential opportunities to improve it, but to dive in and find ways to reward the most efficient and effective Medicare Advantage programs, and frankly reduce the support for programs that aren't measuring up. That's what we should be doing. We are moving in this direction. We don't have to take away the commitment that we have made to America's seniors to improve Medicare, Medicare Advantage, to be able to get even more value out of the system, not just tax dollar savings, but better quality care for our senior citizens, which should be our objective. And I know, Doctor, that's something you've practiced both as an elected official and as a professional, and I deeply appreciate it.
You know, I genuinely appreciate my colleague from the great state of Oregon sharing these stories and the hard work that you've done on this. I know I'm coming up on the end of my time, and I appreciate the opportunity to talk about Medicare as a doctor, as a son, and talk about about the success of Medicare. It's something that we should be celebrating. And I look forward to working with my Republican colleagues to hear their stories of how Medicare has impacted their lives, to work with them to strengthen Medicare, to make sure it is there not only today, but it is there for the next generation, and that it is stronger. And we can do this. We know how to do it, and over the coming weeks and the coming months as we address our challenges, I'll be coming to this floor to share those stories and those ideas of how we move forward as a nation, how we move forward as Americans, making sure we honor the promise that we've made, that after a lifetime of work, after a lifetime paying into a system, that our parents and grandparents, that our